There was a movie in the 1950s called The Next Voice You Hear. And it was about this guy who was listening to the radio one evening before dinner, and he walks into his family's, he walks into dinner with this confused look on his face, and God had spoken through the radio. So, and so everybody's waiting for God to speak again, and he never does. All righty. Let's go ahead and get started. Lisa, once again, thank you for joining us.
My pleasure.
So we'll turn the floor over to you.
Okay, well, I don't know how many of you have seen all of these performances before, so I'm going to go back to, first I'll introduce myself so you believe I have some credential to even say what I'm saying, but I'll go back to some of the original data on the virus, and then we'll talk about variants, and then we'll talk about vaccines, and then we'll talk about where we are now. So I spent 36 years in the pharmaceutical industry. I am a graduate of the University of Medicine and Dentistry in New Jersey, which is now the Robert Wood Johnson Medical University. My background is in immunocytochemistry. So I spent time at Merck Pharmaceuticals back east. I'm a New York City person. And then spent 26 years at Procter & Gamble creating for them their clinical and regulatory groups. So running clinical trials in humans, both for pharmaceuticals as well as for over-the-counter, as well as making the switch from RX to OTC. And I've worked with boards of health on 5 continents now. I guess all 6 now that I think about that. We haven't done Antarctica, no penguin studies. But so my background is both vaccines, but also medicines. The last 3 years, I retired from P&G in 2015, went to work for a small contract research organization here in Cincinnati, who specializes in really cutting edge work with really small, sort of almost rogue pharmaceutical companies. But my specialty for 3 years was actually the mRNA platform. So both treatments and vaccines. And so this is where God sort of brings it all together. And then I became presbyter unexpectedly. So here I am in the middle of a global pandemic. COVID is a common virus. There are 7 types of coronaviruses. 4 of them basically cause the common cold, like a rhinovirus, which is another thing that causes the common cold. 2 of the others have caused what I will call mini pandemics. They're sort of isolated pandemics. One was SARS in 2004 that came out of Singapore. Much more highly fatal, much less infectious, and pretty much contained to Southeast Asia. Then the last one was MERS, which came out of the Middle East in 2012. Same thing, much more highly fatal, much less infectious, and confined now to the Middle East, to Saudi Arabia. COVID-19 is one of the worst viruses, it is the worst virus I have ever seen for infectiousness. It is 3 times more, the original virus, the one that came out of Wuhan in 2019, is 3 times more infectious than any respiratory virus we've ever seen. So it already was poised to be a pandemic. It is not highly fatal and only has about a 1% fatality rate. That's 10 times more than the flu. But things like Ebola, HIV, Marburg, others are way more fatal than COVID is. COVID's insidious nature doesn't come from its fatality rate, it comes from its morbidity. The degree of long-term infection that it causes in multiple body systems is significant. And it is the reason you do not want to get this virus. For every 1 fatality, there are 18 permanent cardiac damages, there are 10 permanent lung damages, there are 3 permanent kidney damage, there are 2 to 3 permanent cognitive decline. One study that came out of the Netherlands last year said that long haul COVID cognitive decline can be 10 IQ points, which is equivalent to 10 years of cognitive decline. It also has significant neurological consequences. For every 1 fatality, there are 2 significant central nervous system defects, everything from loss of taste and smell, which is a central nervous system issue, but also to loss of the ability to walk, to development of psychosis and schizophrenia. So it actually can cause brain damage. It gets into your thyroid, it can mess with your metabolism, it can get into your pancreas and actually cause diabetes, even if you don't have a predilection for it. So it goes organ-wide, it goes throughout the entire system. Variant development is a natural progression of all viruses. It's why we have a different flu vaccine every year. When the virus gets into the cell, so the virus is literally, I'll talk specifically to the coronavirus. It's a sack of fat with those protein spikes on the outside. It's what makes it look like a crown. And inside is a single strand of messenger RNA. The virus gets into the body. The protein spike will attach to a host cell. It injects that messenger RNA into the host cell. The messenger RNA takes over that host cell, creates more viruses, splits the cell open, and that virus then goes and attacks other host cells. So that's how it reproduces. When it reproduces, however, it reproduces incompletely. And so it is literally evolving second by second by second. Most of the variants that emerge fall away because they're not infectious at all. They're just not functional. The variants that emerge that are more infectious than the original virus are the ones that take over. It's just an opportunistic force of nature. So we've had the Alpha, which was the first one that came out of the UK last year. That one was probably about 60% more infectious than the original vaccine or the original virus. The one that we're dealing with now is Delta. Delta is 200 times more infectious than the original virus. It is opportunistically rampaging through the unvaccinated. It is also causing significant disease in the younger, whether they're vaccinated or not. And we're not exactly sure why that is. The chances of catching the virus for the original Wuhan virus, for any virus really, is predicated on two things: the amount of virus particles you're exposed to and the amount of time you're exposed to those virus particles. For the original virus, that minimum time to exposure to infection was 15 minutes. That's how infectious the original virus was. Now, Delta at 200 times that, and I will give you a citation. I'm going to send it to Larry. I'll give you a citation that shows you the calculation. The original virus is 15 minutes. Because the Delta is so much more infectious, the minimum time to infection is about 10 seconds.
Ooh.
That infectious. It is not something you want to deal with. So if you look at the CDC guidance currently, just yesterday, CDC changed its guidance once again to say that Delta is so prevalent in the United States right now that not only are they advising that people who are gathered indoors in groups of people who are not their family mask up, they're now also recommending it for groups of people outdoors. So they've gone back to their original guidance. And it's because of the infectivity rate, and it's because of the effect that it's having on mostly the unvaccinated, but also on the young. The vaccines that we have, 2 of them are based on an mRNA platform. And the other one, of course, is Johnson & Johnson, which is based on a viral carrier platform, something that's a little more common. The mRNA vaccines, everyone is saying, not everybody, that's an exaggeration. People who don't want to be vaccinated are saying, oh my gosh, it happened too fast. Well, the mRNA vaccine platform has been out there for 30 years. We've been testing multiple viruses in that platform to see if we can create a vaccine. We've tried it with HIV, we've tried it with Ebola, we've tried it with Zika, we've tried it with Marburg. The issue isn't safety. These are highly safe platforms for vaccinations. The issue was we never got an efficacious vaccine. So all of those other viruses, we were never able to do anything where the vaccine would help. So none of them were ever commercialized. The COVID vaccine is the first time the mRNA vaccine has shown efficacy, and it's shown efficacy at 95%, which is almost unheard of in a vaccination world. Even things like mumps and rubella have about an 80% vaccination rate. And I said this to the group this morning, I've said it to other groups recently. If you don't believe vaccines work, I challenge you to go into an older cemetery and look at the number of children who were buried as young, within 1 to 2 years of being born before 1950, and then look at the absence of those graves after 1950. And that's because we have largely eradicated childhood diseases through vaccination. Mumps, rubella, smallpox, diphtheria, tetanus, tuberculosis, typhoid, they come back, but they come back in minor amounts because most of the population is immune. So these vaccines work, they are extremely effective, and they are very, very safe. And I wouldn't say that if I didn't believe it. I have seen the data from the Pfizer studies. I've seen the data from the Moderna studies. I've actually even seen preliminary data from the ages of 5 to 12 that are now going on. So these vaccines are not to be shunned. They do work. We will get a booster. Most boosters will be available September 20th. The first booster will be the same as the vaccine that you took originally if you're vaccinated. There are other boosters in development that are specific against the mRNA of the Delta variant. There are other variants that are emerging. There is a Lambda and a Mu. Somebody asked me today about an Omega, and I said, gosh, I haven't heard that one, and it's not on the CDC site yet. So if it's there, I haven't seen anything on it. Neither Lambda or Mu appear to be more infectious than Delta. Delta is predominant in the United States by a large order of magnitude. But both Lambda and Mu both came out of South America. Both of them are now in all 50 states. It does look in preliminary studies like the vaccines generally cover them, but the more a vaccine or a virus mutates, the less effective these vaccines will be. One of the biggest downside of having so many people unvaccinated is that we are allowing more variants to emerge. And so eventually we will get to a variant that the vaccine probably doesn't cover, and then we're going to be right back to square one. So I'm going to go into a little bit of where we are now. So the good news is the vaccines work. Lancet just last week, which is a peer-reviewed medical journal out of the United Kingdom, published a study that gathered data from December 8th of 2020 through July 4th of 2021, and showed that of the 1.2 million adults who received a first dose in the UK, fewer than 0.5% contracted COVID, a breakthrough infection. And among those who got 2 shots, fewer than 0.2% got breakthrough infection. So the vaccines are working, and this is the time of Delta. So they're working against Delta as well. And I have a citation for that. Masks work. There was another study that came out of China that it's on the CDC website. I'm sorry, it came out of Pakistan, I believe. I'm getting my studies mixed up, I forget. But basically showed that flu activity in November of 2020 was 91% lower than in November of 2019 because we were masked. And overall in the United States, we had about 1% of the number of hospitalizations for flu in 2020 than in any of our previous years. So masks do work. Now the bad news, every single county pretty much in the United States is at high risk or highest risk and vulnerability. The only state that seems to have escaped some of that is Nebraska, and they don't know the reason why. They're still at low numbers. Go figure, it must be the cornfields. But numbers right now in most of our counties are high or higher than the worst peak we experienced in July or in January or February of this year. Most of the major hospitals in Cincinnati, and we have a huge hospital system here, including the second most predominant children's hospital in the country, are overrun. The emergency rooms are turning away anybody that isn't infected with COVID. The ICUs are full, and our doctors and nurses are just completely overwhelmed. The Delta variant is racing like wildfire, predominantly in the unvaccinated. 97% of the cases that are in hospitals right now, 99% of the cases in hospitals, 99% of the deaths are in the unvaccinated. 97% of infections are in the unvaccinated. We have a 500% increase in hospitalizations among children just since June of this year. And deaths from coronavirus have jumped 131% just since July. So this is not to be taken lightly. 30% of those who are fully vaccinated and go on to get COVID. Now that's a tiny percent, but even with that, 30% of those who get breakthrough are completely asymptomatic. So if they're unmasked, they are transmitting virus because the unvaccinated or the vaccinated breakthrough carries much virus as the unvaccinated. So my plea for the Presbytery of Cincinnati has been, if you aren't vaccinated and you can get vaccinated, if you don't have a medical condition that precludes you for some reason, please get vaccinated. These are ridiculously safe and effective. And the longer we have unvaccinated people running around, not only are we going to continue to have record number of hospitalizations and deaths, we create the conditions for more variants to emerge. I just saw a statistic about an hour ago that said the average cost for hospitalizing a COVID patient is over $17,000, and the vaccine is free. And that's just stunning to me. If you are vaccinated, get the booster. Even though antibody levels decline over time, that's normal for a vaccine. Antibodies don't hang around unless there's a challenge, unless the virus comes into the system. But your cellular immunity is still very robust. What the vaccine does is it primes your cellular immunity system, your T cells, to recognize the protein on the virus when it comes back into the body. And as soon as that happens, the T cells and the B cells go into to work, and they start creating those antibodies again. So the fact that antibody levels are going down doesn't really mean that you're not still immune, but get the booster anyway. And when boosters come in for the additional variants, which will probably be sometime next year, get those too. Get your flu shot. You'd have to talk to your doctor to see whether they recommend getting your flu shot and the booster at the same time. But CDC and World Health are both predicting a really lousy flu season this year. We got lucky last year because of the masks, but also because the flu season wasn't that bad. But everything you can do right now to boost your immune system is a good thing. The recommendation in the Presbytery of Cincinnati, it's not a mandate. I can't mandate it. I don't have that authority, but wear masks, whether you're vaccinated or not, whether you're indoors or outdoors. And anything that the Presbytery does, any of our meetings, if most of them are Zoom, but if we're in person, we require masks. And then lastly, take a deep sigh and prepare yourself for some fights, because we're recommending that whatever precautions you had in place in January, go back and reconsider doing that again. Because you don't know who's vaccinated. You don't know, even if people are vaccinated, if they have young children at home or someone at home that they're in close contact with who is immunocompromised, who is at risk, or who has some other underlying medical condition. Right now, the World Health is reporting more than 222 million confirmed cases of COVID globally, and with more than 4.6 million confirmed deaths. And those are just the reported deaths. There are many, many more that have never been reported. Every country is involved. Current significant spikes are all over the globe. In the United States, we have way more than our per capita share of cases and deaths. We have more than 40.8 million confirmed cases and more than 667,000 deaths. Right now in the US, we're at about 135,000 new cases per day. And CDC is saying that we could get back up to 200,000 cases per day by fall. 40% of the world population has received one dose of a COVID vaccine, at least one dose, but people in low-income developing countries, only about 2% of the people have received at least one dose. Right now in the US, 62% have received at least one dose and 53% are fully vaccinated. That's ages 12 and up, but that's still not anywhere close to herd immunity. It's not anywhere near enough for us to be able to keep the variants at bay. The vaccines for ages 5 to 12 are still in clinical development. Pfizer should be presenting data to FDA probably sometime in October. One of the prior commissioners of FDA said recently he thought we would get approval sometime between Thanksgiving and Christmas. I'm seeing now that that actually might come earlier. So, isn't that fun? What questions do you have? Yeah.
So we had one of our parishioners test positive. So we suspended our service this week, and those who were in closest contact with that person were tested, and we both tested negative, I being one of those people. And so I said we will be in contact about what happens next. That person is quarantined until the 14th. So my question is, when I'm trying to remember where we were back in January, we were Zooming. We were recording services. We were not meeting in person. So I'm not sure what to tell the session. They're going to have to make a decision, obviously. At this point, they said to suspend for 1 week, and as long as those who are closest to that person were testing negative, we could go ahead and meet in person, masked with the regular other precautions that we had in place when we first started meeting in person again on the 12th. Do you think that's advisable? Is that a guess for all of us? Is that just a guess? I'm not you're not signing anything.
You know, when I worked in regulatory in the pharma industry, because we'd get vice presidents going, so do you think we'll get approval? I would literally take out a magic 8-ball. and every one of my regulatory associates, the first time they went before FDA, got a magic 8-ball as a gift. Unfortunately, I didn't bring it with me. Almost anything you ask me is going to start with it depends. It depends on if everyone will mask, if you can socially distance, if you know for sure no one else has tested positive, which you don't, because like I said, 30% of those who have a breakthrough infection who aren't tested can be asymptomatic. I would recommend all of the normal precautions. Don't pass the collection plate, don't pass communion cups. And that's not because touch is a problem, it's because you don't want people walking around.
Right,
You know?
we haven't been doing that at all. Most of our churches have figured out other ways of passing the pieces different. Everything like that is done safely.
So I've actually gotten tired of nagging my churches to go back to Zoom. So I'm basically saying, if you take all the right precautions, you can probably be meeting safely at this point.
Okay. All right.
Sue.
Hi. So we are still masked and have been masked because of children, but we are not socially distanced, but we will be again. But the biggest question I get from my folks, perhaps from yours, what about singing? Because we are singing with masks on, but we're not socially distanced. So what do you think personally?
So masks are very, very effective. Nobody likes singing with masks, particularly if you don't have the coral mask or even an N95 where there's a little more airspace there, because nobody likes to breathe in the paper or the fabric. But it's better than nothing. The only other thing I would say is I have been recommending against choirs, only because choir members also can't socially distance. I mean, they have to be close to hear each other, and there's just so much more rehearsal time and together time with a choir than there is with just singing a hymn. If you can socially distance, I would absolutely sing masked, maybe not sing all 4 verses, maybe sing the first and the last. One of the most beautiful things I saw, and this was last summer when all of our churches were closed down as well, when the first time one of the churches came back together, it's a church that has screens and projection. It's not a big sanctuary, but they happen to have screens. They actually had someone play the hymn on a piano and just projected the lyrics, and people would just it was a beautiful meditative way to look at what the hymn was actually saying instead of just singing it. And sort of thinking about your grocery list in the back of your head, because it's a rote thing to do. It was a beautiful, beautiful way to have music without singing. So that's other ideas like that, introducing that as a way to get back to what is the core purpose of worship. It's not, let's do everything that makes us feel comfortable. It's where does God get glory and where do we get fed? Yeah. And maybe this is another way of doing that.
Thank you, Lisa.
Yeah, Victor.
So Lisa, I'll give you the question that I get all the time from my parishioners. We are fully vaccinated as a church. I'm fully vaccinated. Why do we have to wear masks?
So statistically, your church probably isn't fully vaccinated. Let's just start there. Okay. If only 50% on average across the country, and the numbers are different state to state and age group to age group, so we can also admit that. But it's possible that not everybody is. However, your bubble is bigger than you think it is. So there are 13 people on this call. If each one of us happened to have been with 10 other people, statistically, not all of those are going to be vaccinated. That means every single one of us on this call has been with 130 people. So it's not just the people who happen to be in the sanctuary for that hour, it's everybody you've seen over the course of several days. I don't know, again, if you saw some of the original stuff that we were talking about last year, But with the original virus, for those people who would go on to develop symptoms, it could take between 2 to 8 days for those symptoms to evolve, to develop. And so that could be 2 consecutive Sundays where someone who actually has COVID and will have symptoms doesn't know it. So that's why you stay masked. You stay masked to protect yourself. You stay masked to protect the people around you. You stay masked to protect the people around you who are going to encounter their grandparents or children or grandchildren who can't get vaccinated or are at risk for other reasons.
One other question I had was, the parishioner that got COVID was vaccinated. How prevalent is that now?
Yeah, so like I said, that one study that came out of Lancet said it's not. If that person was fully vaccinated, there was about a 0.2% chance that they would get COVID.
Okay.
But there's a lot of other factors that go into that. You know, I don't know the medical history of this person or where they were, but between other underlying medical conditions that could make the vaccine less effective, the fact that statistically, and this is a statistic only, the clinical data that these vaccines were approved on said the vaccines were 95% effective. If you translate that, that means 1 out of 20 people is not protected.
Yeah. Okay.
That's what that means. So there's all kinds of reasons why breakthrough happens.
I didn't know if it made a difference. He got the Johnson & Johnson 1 shot. And I think that was less effective than the others, right?
It was much less effective in general, about 80% to 95%, and it was only 56% effective against the original variants. I have not seen data on how effective it is against Delta, but my guess is even less.
Okay, yeah. And there's a lot of our parishioners too, and I'm sure this is true of all these churches, and it was true of this person too, that one of their family members refused, didn't believe in COVID, didn't believe in vaccines, and refused to get it.
Yeah, and so that person probably carried the COVID in.
Yeah.
Yeah. Because even with the original virus, 40% of people who contracted COVID were completely asymptomatic. I mean, it's one of the insidious parts of this virus is that it's out there and you just don't know it. You don't know who you're sitting across from and what their status is.
What was that last statistic again? How many were asymptomatic?
For the original vaccine, sorry, for the original virus, too many V words, 40% were asymptomatic.
40%.
40% of the people who contracted COVID were asymptomatic.
Wow. Wow. Okay.
I have a question about related infections. This past week, my wife woke up with Bell's palsy and went to her doctor. First question, are you vaccinated? We both were vaccinated with Moderna vaccine in February, March of this past year and got a second shot. There's some data on the internet, which I'm unable to evaluate, that either suggests or dismisses either COVID or one of the COVID vaccines as possibly being connected to an uptick in Bell's palsy. Any idea on any of that?
Yeah, first of all, I'm sorry for your wife. That was
it's not been fun.
No, I'm sure it has not been fun. That is not a good one. No, I will say Bell's palsy does tend to be sort of idiopathic. In other words, it just happens. It's not necessarily genetic in any way, shape, or form. There have been some reports, and it's hard to tease it out because there have been so few, but there have been some reports of palsy-like conditions, both with COVID and with the vaccine, but it's hard to tell, which comes first. But it's not, if it is associated, it's extremely rare. And there's, so when an adverse event like that happens, either with a disease or with a drug or a vaccine, there's sort of 3 ways to look at it that will determine whether or not it's related. And one is it serious, which Bell's would be, and serious is hospitalization or disability, that kind of thing. Is it expected or unexpected? And this would be an unexpected one. And is it causally related? And so, and that's the one that, you know, when you get to this point, people go, just not enough time, not enough data yet.
Right.
So,
Thank you. That's helpful.
yeah, that's a tricky one. That is a really tricky one. But I hope she finds some relief. There are some things that they can do.
Her doctor responded very quickly. She's taking a course of steroids.
Good.
And we're hoping that she'll see improvement as time goes on.
Good. Yeah.
Coffee hours.
The other sacred cow, besides singing.
Yeah.
Yeah. We are Presbyterians. Food is involved. I get it. I will tell you what I've told my congregations here, that a fellowship hour is the time when the masks come off and the distance decreases. And those are the two things right now that you don't want. If you have to have coffee hour, luckily here we still have really nice weather right now. It's not hot and humid anymore, and it's sunny. So I would recommend people bring lawn chairs and bring your own food and socially distance outside if you can, and try to visit as best you can. Some churches are having coffee and cookies kind of thing, where people pick up their own and go elsewhere. I don't know of anybody who's having the old-fashioned kind where, you know, women cook a lunch and it's all buffet style, but that's the last thing you should be doing right now. Somebody really suggested the other day that somebody should individually wrap Dunkin' Donuts holes. And I thought that might just be going a little bit too far. That just seems like way too much work for the value of that donut hole. Letty.
My congregation typically is a fundraiser, and that seems to be the sore point, is anything that we have to give up that was a fundraiser. But they have a turkey dinner every year, and usually it's sit down and take out. And this year they're contemplating pretty seriously reinstating it as takeout only, where people would come in through one door, sit socially distanced in the sanctuary, and then come through and pick up their meal with masks and everything, and leave out another door. From what I'm hearing you say, I even feel kind of uncomfortable with that. This would be in late October that they would be doing this. But I'm thinking about the people, the workers that are going to have to still be pretty close together in order to get those meals out. The kitchen people, and we're having a session meeting this coming Sunday, and I'm trying to gather information to give them good input on whether or not this should be something that's a viable thing to do.
Yeah, that's a hard one too, because I'm assuming you're going to have people cooking the food. You're not picking it up from a restaurant where it's prepared and then putting plates together.
Well, the cooking will be done beforehand.
Okay.
In the church kitchen, and then they're going to have people in the kitchen putting the plates together and just handing out a pre-wrapped everything. It's not going to be like served buffet style. Yeah. It's just going to be a whole platter of stuff that people are going to get. But it's still going to have, there's no way not to have people close together working.
Yeah, I mean, again, keep them masked if they insist. Keep them distanced as much as you possibly can. Stations in the kitchen kind of thing. And, one person puts the turkey on the plate and then you move it down the line and somebody else puts the dressing on. If you can do it that way. I don't know how big the kitchen is, but the more you can distance, the better off you're going to be. I mean, the unfortunate part with something like that is you're in close quarters, even masked, for a long period of time.
And there's not going to be a lot of ventilation because it's going to be the end of October.
Right, exactly. And a kitchen gets hot and
yes, it does.
Anyway, yeah. Yeah, Sue.
Lisa, I was not able to be at the 10 o'clock meeting this morning. Was it by chance recorded?
It was. Sundawn is going to have it on her Synod website, and it's almost exactly what you guys heard with some different questions.
Okay, because I sent the link out to my session and then the congregation. But I didn't know if I should show them this recording or the Synod, because obviously we're going to have a called, well, obvious to me, we're going to have a called session meeting.
Yeah, I mean, it's up to you. The data are really the same. And I will do the same thing to Larry that I did with Sendana and just send a couple of documents that you are free to distribute. There's nothing proprietary here.
We had a called session meeting probably about a week and a half ago now. And of course, the session was really divided. You know, there are some that really kind of take the precautionary advice, and there are others, some of whom are not vaccinated. And they don't believe any of this stuff. And some who are vaccinated, again, who don't think we should require masks. We did ask that everybody be masked in the building. So my question is for those of us who are, you know, have some serious medical issues and are nervous about getting this virus, if we have a mask and the person who is unvaccinated has a mask, what are the risks of still contracting this virus?
So it depends on a couple of things. It depends on what the underlying medical condition is, and does that put the strength of your vaccination at risk? Or does it put you just at increased risk of one of the long-term consequences? And like I said, it's pretty much any body system you want to name with this virus. It really is. If it were me, if I had an underlying medical condition, even fully vaccinated and masked, I would at least insist on 6 feet of distance at all times, at the very least. And chances are pretty good I would insist on Zoom.
Which isn't going to happen for many congregations. Yeah. So, and I'm sure I'm not the only pastor. And I mean, people in congregations can kind of decide, okay, I'm not gonna go. But when you're the leader, you kind of have to be there. So that makes it a little challenging.
No, and it's hard. And I do think, and again, this is last year. I haven't seen anything this year. And the congregations in my presbytery too are struggling with where do we go from here? We've got people who want to come back, who want to be in person, who are tired of feeling out of control, and you know, all of the crazy of 2020 across any continuum you wish to name, political, justice, COVID, all of them are all getting mixed up. I have seen a couple of pastors who are medically compromised. One of them has severe asthma, basically say, I can't do this. And so if you want to meet, you're going to have to go to the Commission on Ministry and get a pulpit supply. And that has caused a couple of sessions to think about it, that there were risks beyond the individual who was taking a stance that they were putting people on. Sometimes sharing this data helps, and a lot of times people are just so firmly entrenched it will not. There's no question about that. I'm actually doing one of these Zooms with a bunch of nurses this week who refuse to get vaccinated, which just floors me. So the American Medical Association just put out an abstract that said 96% of doctors are vaccinated, and that's nationwide. So there's no regionality to that. But we've got a hospital here where the nurses are going on strike because there's a vaccine mandate. And I'm just like, whoa, I can't even say the name that I would want to call you because I don't understand the problem. But part of this is the whole, there's a conspiracy theory about COVID and what it is. And then there's the crazy conspiracy theories about the vaccines are magnetized, chipped. It's a way for FBI to track you. I'm like, oh my Lord, really? But there's also a large understanding that, this did feel like it happened very quickly. But like I said, the mRNA vaccine platform has been out there for 30 years. The other thing that made these vaccines come so quickly was we were able to sequence the genome of the original virus on January 11th of 2020. So less than a month after it was even discovered in the United States. And at that point, the government did kick in and told manufacturers, we will pay you to create these vaccines. So it ramped up vaccine production in a really unusual way. The other thing that has happened through all of this, and if there's a silver lining as a scientist, I would say it's this, that all of the data on COVID, on consequences, and on vaccines were open sourced. Nothing was kept proprietary. And I can't tell you how unusual that is in the pharma industry, because actually that's federal law. That data is kept confidential by FDA until approval. That didn't happen in this case. It couldn't. We were facing millions of people dying. And so the emergency use of authorization use of FDA is a standard when there is this medical emergency. It would be the same if America got attacked with nerve gas. We would have a medical emergency and we would have drugs out on emergency use. You want FDA to have that authority. And in this case, they did it with a vaccine that not only has proven to be extremely efficacious, it's also very, very safe. So when you start to put it into those terms, this is not a new vaccine. This is not a never before seen thing. We've had the data for way more than a year now. And the full complement of clinical study that would have happened over time happened anyway. It was just accelerated. So both Pfizer and Moderna each studied more than 45,000 people. They studied people across races, across age groups. They studied pregnant women. They did a phenomenal job of really parsing this out. The emergency use authorization just looked at the first 2 months of data and said, it's so good, go. And now for Pfizer, they've looked at all of the data and said, yes, still good, you're fully approved. Moderna is still in FDA review. I expect that to be fully approved. J&J I have not followed, honestly. It's in emergency use, but I would suspect that that data will be reviewed as well.
So just can I quickly ask my colleagues, and if you want to do this at another time, Larry, that's fine, because Lisa, I know you have time things also. I'm pretty sure my session will not have a problem with going back to the socially distance and to do everything. And I'm not, well, I have fibromyalgia, but that's not really a compromise. But my husband has type 2 diabetes. And, you know, I worry that should he even be in the sanctuary? Should he, you know, and it scares me. So, you know, there are other ways for us to minister to our people. So I'm just thinking, if my session says, no, you got to be here, and the numbers are such that I don't feel safe, I'm thinking, well, then we're going to have to talk. Can we come up with a compromise of me doing this by Zoom or something? But I don't know how you all are feeling about that.
My wife has moderate asthma, and it has always been a concern for me. I preach with a mask, and I've been told how unusual that is. I don't know, and yes, I am concerned. We are having a congregational meeting this week because we absolutely have to do this in person. I'm wondering about that, but we're gonna follow all the protocols we can. And I get an awful lot of feedback. We have several people in our congregation who are very vocal about that this is ridiculous that we're taking all these things. And I just feel like the session, first of all, needs to take up the gauntlet on this, take up the mantle on this. But I think we have to stand firm on the protocols. I'm sorry, Sue.
Lisa, so I preach without a mask. I'm pretty far removed. But is it your suggestion that I should preach with a mask or at least have some sort of plexiglass stuff up?
Yeah, the plexiglass is good if people are spitting on you, and if people are spitting on you, I would recommend another job anyway. But it doesn't change the airflow. So I preach every Sunday too at a different church, and unless it's a tiny sanctuary where I can't be distanced by at least 12 feet, that's the only time I'll wear a mask. If I'm in a big sanctuary, and I've got a bunch of them, if I'm 20 feet away from people, then I will take the mask off to preach. So I'm comfortable doing that. I don't have any underlying medical condition, and I'm fully vaccinated, but that's okay for me. But it goes right back on as soon as I'm done preaching. And so I sit there with the mask on. We just recently had our first in-person presbytery gathering. We do them quarterly. Everything's been by Zoom since last winter, but we had one in August that we snuck in. It was in a huge sanctuary. We probably had about 60% of the people we normally do. So they were very able to spread out, and we required masks, and we did fine. If I were to hold that presbytery gathering this month, I would not do it in person. I would do it by Zoom.
For us, Sue, this will obviously become a matter for the session to discuss. And I will distribute this video once it's available. We're in a somewhat unique situation in that we have almost an entirely retirement age congregation of 40 in a sanctuary that seats 500. And we have every other pew blocked off. We have windows open and fans working at this time of year, but as we go into the fall, it'll be curious to see what we decide to do. One of the things that was very helpful, I thought, previously, is both New York State and the county came out with, they were more than guidelines, they were requirements for public assembly. I really wish we had that kind of guidance again from our governmental leaders. That may be just me trying to shift the responsibility to someone else, but I think for our congregation, it made sense that we were trying to be good neighbors and to not only keep our congregation safe, but this was part of a community effort. And I just wish that we had that again.
Yeah, I took my picture off because my puppy was wanting to go out, but I'm still here. You're absolutely right. And in Ohio, we had, originally our governor did a phenomenal job, as well as the Ohio State Public Health Group, in terms of really keeping numbers, keeping people safe, mandating masks, mandating quarantines. And politically, there's no way on God's green earth he will ever do that again, because they will literally lynch him. So I completely agree and concur. Unfortunately, it doesn't matter what your political persuasion is, the way our government as a whole last year handled this, split it into state by state decisions that made this almost impossible to get ahead of. And then as a scientist, I get snarky for a second. They just cut the knees out from under CDC. So there was no unified federal oversight of anything for COVID. And it's why, my humble opinion, we have a disproportionate number of cases and a disproportionate number of deaths based on our population versus the globe. So I agree with you, Mark. If the government could step back in and do something unified, it would help everyone.
Well, and I've often thought that the script needs to be flipped, and we need to encourage people to get the Trump shot. And I'm wondering if that would, I mean, it was developed largely under the former administration. Let's give him the credit that he's due and name it in his honor and make it a matter of identity to proudly get your Trump shot, but maybe it's too late for that.
No, I will say that, again, whatever your political persuasion, they did a phenomenal job of financing development of the vaccines and pre-ordering vaccines pending their availability and approval, so that the pharmaceutical industry had the money it needed. That's one of the reasons it went so fast. So yeah, it was an unusual time for science. Let's just put it that way, in so many different ways.
I have a quick personal question. Many of us have grandchildren, and they're too young to be vaccinated, and school starts this week. And I've gotten real used to being able to see them and be with them and play with them and do everything I want to do with them. And now I'm getting anxious about, particularly since our school system is not mandating vaccinations. They are masks. You know, everybody has to have masks when they're in the building, but they're not mandating vaccinations for teachers and staff. And that makes me anxious as well. So in terms of my, all of us with our contact with our families, and we've gotten used to being indoors with them and not having to have masks on, and it's going to be hard if I have to go back. I mean, I will, but if that's the trade-off between being able to see them and not see them. But is it your recommendation that when I'm with my family, especially indoors, that I keep my mask on? Keep in mind that my husband has a form of leukemia and he's doing really well. And actually he got an extra shot a couple of weeks ago.
Good. Praise God on both those counts.
Of the Pfizer, yeah. So that's good. But is it your recommendation that we keep our masks on when we're with our grandkids?
That's a really good question. I mean, I'm glad the school system is mandating masks. That's a big help. We've had school systems here in the Cincinnati area that have literally shut down for weeks at a time because of just ridiculous amounts of absenteeism, because of symptoms that, whether they were COVID or not, everybody wanted to take the precaution. And there was one school, not in my presbytery, but nearby, that one unvaccinated teacher infected 22 of her 30 kids. And so it's going to happen. The masks will help. I think the best you can do is just see how it goes. If they've got symptoms, I would definitely mask yourself and your husband. And if they've got symptoms, I might think about just not seeing them for 2 weeks, as painful as that is.
Okay. Thank you.
I think the hard thing in all of this is it's been going on for so long that people now have like hit a wall, and they just feel like, well, this is just going to go on forever. So they kind of are throwing caution to the wind again. And in the situation here, we really kind of decided, most of us, that we need to be masked indoors, but not everyone is adhering to that. And unless you have a bouncer at the door, what do, right? And then, in the sanctuary, people are masked, but then they're meeting in rooms, having different meetings, and those same people are all unmasked. And I know some of them are unvaccinated. And I mean, I have to be honest, I'm concerned for the people here, and I'm concerned for myself. Yeah, it is really hard. I will say that the World Health Organization has declared COVID to be an endemic virus, which means it's not going away. We will be dealing with this for many years. Just like smallpox was endemic until we had a vaccine that eradicated it. This is going to be the same thing. And right now, honestly, even though at least half of America is sort of vaccinated or vaccinated in one way, shape, or form, the rest of the world is not. And international travel has not stopped. I mean, there is still international travel going on. So this is going to take several years to resolve. There's no doubt in my mind. So now that I've thoroughly depressed all of you.
Oh, we're grateful.
I don't know how we can find the words to express our thanks at your generosity.
Amen.
It is my great pleasure. I'm sorry that it has to happen, but I will, Larry, I will send you some documents. Please do feel free to distribute liberally. You may send them to your sessions, send them to your congregants, however, your family members. There's nothing in there that is not public knowledge. So you're welcome to use that. And if you've got other questions, Larry knows how to get a hold of me. My email address is on the Cincinnati Presbytery website. Go ahead and send it. If I don't know the answer, I'll go look it up.
And you feel comfortable with that?
Absolutely.
Okay,
Absolutely.
great.
Yeah, absolutely.
Very gracious of you. So
Thank
Yeah,
you
happy
so
to do it.
much.
Yeah,
Yeah.
you're welcome. You're
Thank
welcome.
you.
You guys stay safe and be blessed. All right.
Yes.
let's
you
close
too.
with this prayer.
Take care. Bye.
Let's close with this prayer. Don't leave us yet.
I will leave.
Weaver God, we come to you. Or more the truth, you find us disconnected and out of sorts, disheartened by our failures, discouraged by our weakness. Weave for us the tapestry on which our lives are stretched. Give us patience with the endless back and forth of shuttle, hand and effort. We look too closely, seeing only strands and knots and snarl threads of too much trying, or none at all. Grant us eyes to see the whole of which we are a part. In the end, we ask for gentleness with ourselves, acceptance of our less than perfect ways. We pray that what we do and what you weave forms a pattern clear to us all, of mercy in the warp of it, and love throughout. In the name of the Christ that redeems us all, we pray. Amen.
Amen.
Amen. Thank you, Larry.
Thank
Guys, be blessed.
Lord be with you, friends.
And also with
Also
you.
with you.